the Tobacco Education and Prevention Coalition for Porter County. My name is Mike Bonaventura. I'm co-moderator along with Don Spears from Ivy Tech Community College. We're going to start by just kind of laying a couple of ground rules. Everybody that's watching, please stay muted. If you do have a question, you can use the chat. Don is going to monitor the chat area so that we know those questions are coming through. And we'll give Don, of course, plenty of opportunity to go through those questions as time permits as well. So I'm Mike Bonaventura, as I said, from Adams Radio Group. Just a couple of really quick things. Being a moderator, I don't know really what to expect. This is the first time I've done this, but let me say this. I've been smoke-free for 11 years. One of the reasons why I wanted to do this was because I wanted to spread that word. I was talking on my radio show today on Z107 about that very topic. And the thing that I would say is, today's the Great American Smokeout. If you're ready to quit and it's something that you really feel passionate about doing, I suggest you quit, specifically for your health and everybody around you, because everybody gets affected by secondhand smoke and even, I believe, secondhand vape. So with that said, let's go to Don Spears from Ivy Tech Community College. Don, if you would, could you explain what the TEPC is and what it does and how it functions?
Absolutely. We are a coalition of various healthcare agencies, educational institutions, and physicians, nurses, other professionals who have interest in working to decrease smoking and vaping in Porter County. We meet monthly. We have many special events. And I would like to encourage anyone who's here today, if you're interested in participating, you can get more information by emailing Carrie, whose email address you should have from the sign up and the invitation.
Cool. So Carrie Higgins, you're the program director of the TEPC. Tell us a little bit about what you do as program director.
So we have many hats that we wear in the program. So this is one effort of one of our biggest efforts is to reduce the use of tobacco products in our youth for obvious reasons, because if they don't become users, then we're good. You know, that's what we want. So that's one effort, but we also work with school systems. We work with doctors' offices to refer people to get cessation services. And we try to get people to use the quit line, the Indiana Tobacco Quit line, 1-800-QUIT-NOW. And so we have a texting program for students who would be more apt to actually text in, but we also take a look at apartment complexes and housing and trying to be smoke-free through policies with the state, the counties, and the cities and towns. So we work with policymakers to try to make every business, every work site, every city or town a healthier place to breathe and to live. So we do quite a bit. And we have a youth group that also, if anyone has kids 13 to 18, we're recruiting right now for our youth group that goes out with those positive messages as well. So yeah, that's some of the things that we do. And so we have great coalition members from all over, from organizations that participate with us, like Don said. And I can't thank them enough, because without those coalition members out in those community, we wouldn't really accomplish all the things that we have accomplished. And today, just as a reminder, we're doing this on the Great American Smokeout Day, which is the American Cancer Society's effort. And so we're going to talk about some of these things today, but that we also have a couple of things we don't often think of when we talk about the ramifications of school children or middle schoolers or high schoolers vaping. And we're here to talk about mainly vaping and all the issues around it. But sometimes we don't think of the little things too that happens because of vaping. And one of the things I found out today was that the incidence of the rate of younger people, especially under 5, who have had to call, their parents have had to call poison control because of vaping, because vape pods and pens and things like that have been left laying around. And so the statistic was in 2011, 269 calls were made. 269 calls were made to the poison control. In 2019, 5,356 calls were made because of vape liquids, vape devices being left around and children getting a hold of them. So that's a huge difference. So, here we are going to talk about youth and teens and young adults, but sometimes we forget about the peewees that are exposed too, and that affects them as well. So anyway, thank you everyone for coming. We really appreciate it. We're here for you. We are in Porter County. We are here to help everyone, whether you're a business or a healthcare provider, a school teacher, social worker, police officer. We work with all kinds of different factions to try to work together and collaborate. So thanks for being here.
What about website and social media presence?
Yeah, so if you are wondering about anything, a lot of our resources are posted for you already. There's a lot we might bring up today, but they are posted on our valpo.edu/TEPC. And that's our coalition website. You probably, if you're here, you registered on that website. There are multiple tabs that have lots of cool information about how to quit, where to get more information on how to quit. Plus the CDC and and places like that have just great stuff out there as well. We do have a Facebook page. Check us out. You can always keep up on what we're doing. We post quite often, and you can see some of the things we're doing. So if you even want to join us, if you think that you would like to get involved as a coalition member, we are looking to make sure that we have every population in Porter County represented on that coalition. And we do have a few gaps, and we'd like to do that. So thank you.
The idea behind this particular program and the things that we're going to talk about in terms of goals, facts about vaping and tobacco use in Porter County, how and why the tobacco industry intentionally targets the youth of Porter County, and how early nicotine use affects brain development and hooks youth for lifelong habits. So we'll get through all those different things during the course of the program. I'd like to actually introduce the panel that we have here. We'll start with Lindsay Sample, Northwest Indiana Pulmonary Critical Care. Hi there, Lindsay. How you doing? She's right next to me, right there.
Hi, Mike. I'm doing good.
Good. Awesome. Awesome. We'll get to you. You're going to be our first speaker. So we'll get to you in just a little bit. Caitlin Rupp, Tobacco Prevention and Cessation Commission. Hi, Caitlin. How are you?
Hi, Mike. Doing well. Thanks.
Very good. Very good. What else we have here? We have Megan Fisher from Porter Stark Services. Hi, Megan. How are you?
Hi, Mike. Excuse me. Yep. Megan Fisher, Director of Recovery Engagement at Porter Stark, and also personally 7 years tobacco free. And congratulations to you as well, Mike.
Nice. That's cool. Yeah, it's good to be able to breathe a little bit, right? Dr. Teresa Kessler from Valparaiso University, the College of Nursing and Health Professions. Hi there, doctor.
Hi there. Yes, you can
Yes.
call me Teresa, that's for sure. And yes, I'm from Nursing Health Professions. I'm a nurse, an advanced practice nurse, and I work with undergraduate students, and we've been doing research on vaping. So that's why I'm happy to join you tonight.
Very interesting. Scott Yonover, who's a Chicago attorney. Is Scott in yet or not? May not be. That's okay. We'll come back later. So we've got all these people that we're going to get to. And as I said, the first guest was Lindsay Sample. Once again, she's a Northwest Health Pulmonary Critical Care. So tell us a little bit about some examples that you may have had with some of the patients that you've seen over the course of time, Lindsay.
So my experience is both at the community level and both at the university level. I have experience here at Northwest Health, Porter, in pulmonary and critical care. And then also at the University of Chicago, I was a member of the lung transplant team. And, we really have seen an influx of these e-cigarette, vaping related or vaping associated lung injuries, EVALIs. you know, as earlier mentioned, you know, I've seen patients as young as age 8 present to the emergency department after using a vape, and as old as age 75. Most commonly, I see around the ages of 13 to 25, and more frequently male than female. But I have, you know, seen a fair share of both. Symptoms that these patients present with, a sudden onset or a new onset of a respiratory illness with no sick contacts, no, you know, no real underlying respiratory concerns or conditions, no premature lungs or history of asthma. These patients have shortness of breath. They have cough, plus or minus some hemoptysis or bloody sputum. They have chest pains. They have fevers. They have chills. They have nausea and vomiting, diarrhea, abdominal pain, headaches, and weight loss. And those are just some of the subjective findings that patients present with when they come to the emergency room. The objective findings, things that us as providers, nurses, nurse practitioners, and physicians find when we assess these patients, are elevated temperatures. They're usually febrile. They usually have some tachycardia or elevated heart rates, greater than at least 100 beats per minute, tachypnea, a respiratory rate greater than 20. They're really working to breathe. You can tell they're really sucking for every breath that they have. And then some hypoxemia, oxygen level less than 88%. They appear toxic. They appear sick. When we start to see these patients, of course, many are young. Many of them are teenagers. Mom and dad are there, and they're very scared to tell mom and dad, much less a medical provider standing in a white coat over top of them, that they've been using any sort of device like a vape or an electronic cigarette, a pen. And so when we assess these patients and we get some history from them and mom and dad, we really have to keep that evaluate in our list of differentials, especially if there's any history of e-cigarette use, pneumonia or influenza-like symptoms, or progressive respiratory failure. It's something that we just can't wipe off and say, oh, it's just the flu, or oh, it's just an asthma attack. We have to keep that there. Things that we ask once we have a little bit of information or even some understanding that this possibly could be what was going on. We want to know what types of products were used, what substances were vaped, if they used cartridges or pods, if they were reused or refilled, and with what, and who refilled them. When did the vaping start in relation to the onset of symptoms? Vaping related injuries can, we may not see symptom onset for 90 days after the use. So it's interesting to know that somebody could be vaping today and we may not see the cumulative effect of what that has done to their lungs for more than 90 days. How often do they vape? Do they smoke tobacco or marijuana? Do they use any other sorts of illicit drugs? When we start to come together, and even when we don't have a full picture of what's going on, we have to start a medical workup pretty quickly. These patients are toxic and they're usually requiring some oxygen therapy. Some of them require hospitalization. They require medications to help calm the inside of their lungs down, antibiotics. So we do a lot of blood tests, chemistry panels, complete blood counts. We do infectious panels. We get samples of their sputum and send that for culture. We send urine for strep, pneumonia, and Legionella, histoplasmosis, blasto antigens. We do blood cultures. Oftentimes they require an echocardiogram of the heart, chest x-rays, CT scans of the chest. They may even need a bronchoscopy where they'd have to undergo some anesthesia and have a pulmonologist go down into their lungs and wash the lungs out to inspect the surfaces of the lungs and to get samples. And they may need biopsies. We may actually have to go into the lung space and take tissue biopsies as well. EVALI is considered a diagnosis of exclusion, and diagnosis occurs with the use of an e-cigarette or related product, again, within 90 days of symptom onset. Bilateral opacities in a chest x-ray or on a CT scan. Exclusion of infection. So normally we see elevated white blood cell count. We see the bilateral opacities on the chest x-ray or CT. but we can't identify a specific infectious pathogen. And of course, the absence of an alternative diagnosis. When we talk about all of that and bring it together and come down with a diagnosis, treatment is taxing on patients, on families, and on healthcare providers. They may or may not require hospitalization. It depends. It depends on where we are and the damage that's been done to the lungs. Excellent supportive care is important. And so enlisting the community, the physicians and nurse practitioners, the nurses at the bedside, and of course, family members, siblings, and friends. Antibiotic care, steroids are often required. Oxygen therapy. Usually we start off with a nasal cannula to try and get patients greater than 90%. It can progress to high flow nasal cannula. It can progress to BiPAPs, and it can progress to needing a breathing tube, intubation, and ventilator. We have patients that lose their lungs. They start having holes develop in their lungs and they get pneumothorax. And so sometimes chest tubes are needed to help reinflate those lungs and pull the air out of that chest cavity so the lung can re-expand. In my experience at the university level, we have had these patients on ECMO where we actually cannulate these patients with big tubes in their neck, in their chest, in their groins, and we're able to pull their blood outside of their body, oxygenate it, circulate it, and pump it back in to bypass either the heart or lungs or both. You know, the long-term effects of this, financially, it can cause utter devastation for families and patients. They miss school. Sometimes they require lifelong medications for the damage that has been done to their lungs. They usually develop a lifelong relationship with a pulmonologist and or their nurse practitioner. Decreased physical mobility, unable to participate in sports and the things that they once loved. Of course, they have that loss of trust, oftentimes between parents and other, people that once maybe looked up to them. And then, of course, we have death. We lose a lot of patients to vape-related lung injuries, and sometimes they're just not recoverable. Lung transplant is always a possibility, but when we have a patient that has used any sort of substance within 6 months, we can't list them, we can't transplant them, and most transplant centers will require you to be substance-free for at least 6 months before they'll add you to their transplant list. Of note, now that we're in the middle of this COVID pandemic, vapors are 5 times more likely to contract COVID-19. They oftentimes, especially in our high school and teenage population, are sharing a pen or a vape, and they're also, having their hands to their mouth after using, after frequent, touching of tabletops and things like that. They're not necessarily concerned about the hand hygiene aspect that, we worry about and warn about on a day-to-day basis.
What about transmitting COVID-19 via vaping?
Well, those respiratory particles are in the pen, on the pen, saliva and respiratory particles. And of course, they're blowing out respiratory particles. So of course, all of that definitely increases 5 times more likely to contract COVID-19 if you're a vapor.
You were talking about when they come into the hospital, they're toxic. How much of that vape do you think they've consumed in the course of a day to get them to the point where they have to come to the hospital?
It doesn't need to be very much.
Really?
It truly depends on the chemicals involved. It truly depends on their lungs. Have they recently had a respiratory illness? Maybe they just, had an influenza or something, maybe a common cold, or maybe just an allergen trigger that had things just a little bit flared up in there. And then they use a chemical that's, a lot of that stuff, we just don't know what it's made of. You can buy it on the internet. There's very little tracing as to what it's made of. And so it can be deadly with minimal use.
Don, do we have any questions for Lindsay in the chat box?
We've got one question, but I think that it's going to be more appropriate for our next speaker. Oh, I got one that just came in.
Okay.
I haven't heard the 5 times more likely to contract COVID-19 statistic before. Can you point us to the source? I'm not surprised, but I would like to be able to show people the research if I get challenged on it.
Absolutely. Give me just a minute. I'll pull the article and I'll post the link in the chat box.
Cool.
That link
Okay.
is also, I'm trying to think of the university that did it, but that link is also already posted on the Facebook page for Porter County TEPC. So I
I
can
just have
easily
to
go,
figure out which one it was.
yeah, it was
I've
posted.
got another question that came in. If that's one that you need to look up, we can address that one later on or put it on the website. I've got another question. With all the cases and medical testing taking place, are you finding there are certain types of vapes or certain chemicals in the vapes that are more serious in nature?
We find that anything mixed with vitamin E oil seems to be the worst in what we're seeing. There's still a lot of research coming out. And then, of course, there's a lot of chemicals that we just don't know about. But it seems the most prominent chemical that I learn about when I talk to these patients, especially the ones that have progressed to ECMO and lung transplant, or the need for lung transplant, has been vitamin E oil.
And what would oil do inside the lungs?
Well, it's a viscous chemical. It coats the lungs and you don't have that same diffusion capacity. So in order to, your lungs are very clean and they do have a moisture in them, but, carbon dioxide, comes out of your bloodstream through your lungs, and oxygen, goes into your bloodstream. And so when that oil coats that, it just, you don't have that same diffusion capacity. It can erode and cause all sorts of damage.
Wow. Don, do we have any other questions?
Not for the speaker, no.
All right, Lindsay, thank you so much. And, we may circle back to you at some point, so stay with us. So we've got Caitlin Rupp, Tobacco Prevention and Cessation Commission, who's going to talk to us about sales and marketing. And hi there, Caitlin, how are you?
Hey, thank you. I'm just going to pop on here on camera and say one more hello to everyone, and then turn off my camera to conserve some bandwidth here. I'm going to share my slides here, so bear with me.
Mm-hmm.
Okay, can someone just confirm that my slides are up and everyone
Yeah, we
is
see it.
able to see them? Okay, all right, fantastic. Okay, so I'm going to talk about the retail environment in Porter County specifically, but also around the state. So I do have a couple slides. I'm going to move through these pretty quickly, if I can figure out how to get to my next slide. Okay, here we go. All right, so over time, we know that tobacco companies have changed the way that they market their products. So these pictures really illustrate this progression really well. The pictures you see on the left are examples of what tobacco marketing used to look like. Many of you who might be my age remember Joe Camel, the cartoon character, which directly appealed to kids and was designed to do so. Tobacco companies gave away lots of branded gear, lots of promotions, lots of giveaways, t-shirts, hats, other items with those tobacco company logos on them. And they could advertise on billboards and sponsor sporting events. If you're a race fan, you might remember the Winston car and the Marlboro car just plastered on those race cars. So tobacco advertising has been restricted over time over the last few decades. And, that's not to say that it's gone away, which is what we're going to demonstrate today. Tobacco companies have had to adapt and change the way they market their products. And so now, instead of those billboards, sponsorships, cartoon characters, branded gear, tobacco companies spend most of their marketing dollars at point of sale. We're going to talk a lot about point of sale. The pictures on the right give a nice snapshot on what point of sale marketing often looks like. So what is point of sale? What do we mean when we say tobacco point of sale marketing? Essentially, it's marketing tobacco products to consumers where they purchase, at the point of purchase for tobacco products. It includes retail stores, convenience stores, gas stations, grocery stores, pharmacies. Unfortunately, a lot of different retail outlets sell tobacco products. And point of sale marketing includes things like price promotions or discount on tobacco products. As some of you, if you enter a convenience store, you might see a buy two, get one free special on a cigarillo or something like that. In-store product displays that are often very colorful and eye-catching. Product placement, strategic product placement near candy, gum, other youth-appealing products, and retail advertising. So it's also important to keep in mind this is purposeful. Retailers often have established contracts with tobacco companies that specify exactly where tobacco products have been placed, at what height, etc. So it's a very intentional form of marketing. And this really drives home the point about the amount of money that the tobacco industry is now spending on point of sale marketing. We know that if they're investing this kind of money, it has to be effective, and they realize that. So tobacco companies heavily invest in this type of marketing. These are 2018 numbers. In 2018, tobacco companies nationwide spent about $9 billion on tobacco marketing, and that's over $1 million per hour in the US. About 92% of those marketing dollars, or 8.4 billion, were spent on point of sale marketing. In Indiana, that breaks down to about $290 million spent every year, which equates to $45 per Indiana resident every single year on tobacco products. And that includes youth and adults. So why does point of sale marketing matter? And why do we want to talk about it? Why do we want to raise awareness about it? So the reason why tobacco companies invest so much money in point of sale marketing is because they know that it's effective. They know that it works well. And they're concerned about their bottom line, frankly. So point of sale marketing has been shown to increase the likelihood that youth will start using tobacco products and progress to regular tobacco use. And this is really important for tobacco companies because about 9 in 10 smokers start by the time they turn 18 years old, and about 99% start by age 26. So they really try to and are successful in hooking them young. Tobacco companies know that if young people don't start using tobacco early, they probably never will. And it's really important for them to maintain a base of youth and young adult smokers for sustaining their business. The retail setting is also a very powerful way to reach youth, as about 75% of youth shop at convenience stores at least once per week. Second, point of sale marketing makes it more difficult for existing adult tobacco users to quit. And research has shown us that tobacco users exposed to point of sale marketing may experience more tobacco cravings and are most likely to make impulse buys and less likely to successfully quit when they're primed and inundated with these ads at point of sale. And just lastly, we know that point of sale marketing disproportionately targets some communities. We know that communities of color and low income communities are disproportionately targeted with certain types of products and certain types of ads for products and price promotions and discounting, which is really predatory on the part of the tobacco industry. And this really is a social justice issue if you look at break it down by neighborhood, as we have been able to do with point of sale. So let's talk specifically about Porter County. When we study the tobacco retail environment, we often talk about these concepts called density and proximity. Density is a measure of how many tobacco retailers there are, including convenience stores, tobacco shops, etc., in a particular location. So in this case, we measure density as the number of retailers per 1,000 people in Porter County. And then proximity, on the other hand, is a measure of how close a tobacco retailer is to another location, such as a school. Sometimes we look at parks or other tobacco retailers. As of May 2020, there were 144 retailers total in Porter County and just under 7,000 statewide. This equates to just under one retailer per 1,000 people in Porter County, which is slightly lower than the tobacco retailer density statewide. And we might just want to recognize that retailer density is not uniform across the county. Retailers tend to cluster in some neighborhoods more than others. And in particular, we saw that nearly half of tobacco retailers, or about 43% in Porter County, were located within 500 feet of another retailer. So paying attention to these clustering patterns is important, as smoking trends tend to be more prevalent among youth and young adults in areas with higher retailer density, as to be expected. We also look at proximity of retailers relative to schools, as research has shown that youth smoking prevalence is higher in schools in areas with higher tobacco density. And it makes sense if you think about it. So the data that I'm going to display on the next few slides come from a series of tobacco retail assessments that were collected in 2018 and 2019. And you can just see a summary on this slide. In total, there were 107 assessments completed in Porter County during this time. So we're going to go over the results here. Nearly all of the retailers that were surveyed in Porter County and across other counties sold cigarettes, so that's a given. Additionally, the majority of retailers also sold little cigars or cigarillos, smokeless tobacco, and e-cigarettes. And a somewhat smaller proportion of retailers sold premium large cigars, which aren't as popular. In addition to assessing what products were available at point of sale, we also collected data on retail advertising placed outside of the store, and I've shown some examples on this slide. So this includes advertising on building walls, in windows, on gas pumps, anything in the exterior environment of the store. And this type of advertising is important because there are a lot of people that might not be entering into a convenience store, might not regularly go in, might just be there to get gas, and they're still prompted with this type of advertising. Kids can also be exposed to these ads in a car while their parents are purchasing gas, or simply just by walking around in their neighborhood. In Porter County, we saw that over 3 in 5 retailers surveyed displayed some form of exterior tobacco ad. In general, the most heavily advertised products were cigarettes and menthol cigarettes, followed by smokeless tobacco, e-cigarettes, and little cigars or cigarillos. So overall, these results suggest that exterior advertising is really common among tobacco retailers. So we're going to talk a little bit about youth. I know this came up earlier. In addition to exterior tobacco advertising, we assess the products and marketing tactics that specifically target youth, that research has shown to target youth and lure youth in to start using tobacco. We assess the availability of flavored tobacco products. Although flavored cigarettes and other than menthol cigarettes have been banned in the US as of the 2009 Smoking Family Prevention Act that was signed into law by President Obama, other products such as cigars and cigarillos, smokeless tobacco, and e-cigarettes, especially e-cigarettes, are available in a wide variety of flavors. So these are sweet, candy, or fruit flavors that have often been shown to appeal to youth. These pictures show cigar brands that are popular with youth, available in a wide variety of flavors. We also know that youth who use tobacco, the majority of youth who use tobacco products, use flavored products. And we know this from our youth tobacco survey. So in 2018, over half of Hoosier youth who used a tobacco product reported using a flavored tobacco product. You can see that that's about 53% of middle school tobacco users and nearly 65% of high school tobacco users. The vast majority of tobacco retailers in Porter County, 97%, sold any flavored tobacco products, while similarly, but a little bit lower, across all counties surveyed, about 9 in 10 tobacco retailers sold flavored tobacco. In addition to flavored products, some tobacco marketing tactics such as price and placement of tobacco products particularly target youth as well. So think about youth as a very price sensitive population. They often have limited money, limited resources, and they don't have a lot of money to spend on these products. So cheap products tend to appeal more to them. Often tobacco products such as cigars that are priced much more cheaply than cigarettes, as we just discussed, are available also in a variety of flavors that appeal to youth. They may also be sold in smaller packaging, such as packs of 1 or 2, which make them even cheaper. So in these pictures, you can see how cheap some of these products are, just as an example. And these ads are commonly placed at kids' eye level and very near candy, soda, or toys, which is illustrated in the example to the very right. So these tobacco marketing tactics were fairly common among retailers surveyed in Porter County and across the state. Nearly 2 in 5 retailers in Porter County had tobacco ads placed within 3 feet of the floor or at about child's eye level. And about 28% had tobacco placed within 12 inches of kid appealing products such as candy, soda, gum, etc. This was slightly higher than the results for all counties surveyed. In addition, retailers that sold cigarillos, cheap cigarillos, among retailers that sold cigarillos, cheap cigarillos were widely available. More than 8 in 10 cigarillo retailers in Porter County sold cigarillos for less than $1. So extremely cheap. They're often flavored and they're often placed near other kid appealing products. So finally, we collected data about price promotions on tobacco products. And price promotions are really important because they represent the largest category of tobacco point of sale marketing, meaning tobacco companies spend more on these price promotions than any other type of advertising. And it's such an important part of their marketing because one of the best ways to reduce tobacco consumption is to raise the price of tobacco products through an increase in the cigarette tax, an increase in the overall tobacco tax, or another price raising strategy. Tobacco retailers therefore offer price discounts to appeal to customers to offset these policies once they're put in place. And these pictures just display a couple of examples of price promotions and coupons. Overall, again, quite common for tobacco retailers in Porter County to offer price promotions. 71% of tobacco retailers in Porter County offered promotions on any tobacco products. And that was a little bit higher than the 61% of retailers across all counties surveyed. We also gathered data on the price of specific tobacco products. So in Porter County, the average cheapest price of a pack of cigarettes was about $5.11, slightly higher than the all counties average, but still relatively cheap and probably what you'd pay for a drink at Starbucks these days. I don't know, maybe Starbucks is a little bit more than that even these days. Newport menthol cigarettes were slightly more expensive at $6.25 per pack, and blue disposable e-cigarettes averaged about $8.75 per unit. And while these products are priced slightly higher in Porter County, the key takeaway is that cigarettes are still relatively cheap here in Porter County. And additionally, other products such as cigarillos and little cigars continue to be available at extremely low prices. So ultimately, this makes tobacco more accessible to consumers, and particularly to price-sensitive individuals like youth and low-income adults. So I'm going to wrap up and just state some of the overall takeaways of what we know about point-of-sale marketing. First, we know that the tobacco industry relies heavily on point-of-sale marketing tactics to market their products, spending 95% of their annual marketing budget on point-of-sale marketing. Secondly, we know that point-of-sale marketing encourages youth to use tobacco, makes quitting tobacco more difficult among adults who are established tobacco users, and disproportionately targets some communities, which contributes to health disparities and gaps in tobacco use rates and tobacco-related health outcomes. Finally, a higher proportion of Porter County tobacco retailers engage in point-of-sale marketing tactics, such as displaying tobacco ads, price promotions, and promoting cheap, flavored, youth-appealing products. I just want to mention briefly this report that was published by the CDC's Office on Smoking and Health in collaboration with a university partner that was just released in September of 2020. And it's called Boosting the Tobacco Control Vaccine. So just really quickly, it kind of just drives home the importance of working on point of sale as a strategy in evidence-based tobacco control work. And I'm going to just let you all read that if you're interested. So the bottom line is the components of the tobacco control vaccine mirror best practices in tobacco control and include comprehensive smoke-free air policies, high tobacco price increases, statewide comprehensive media campaigns, and cessation access. But in addition to this, we now know that the retail environment is really important as a strategy that is part of a comprehensive approach because of its effect on health equity, availability of the product, and youth uptake. So really, really crucial that we start and continue to talk about point of sale marketing and tobacco control. So what can be done about this? So unfortunately in Indiana, there is a preemption law regarding the regulation of tobacco retail at the local level, which means that only the State General Assembly can regulate the sale, distribution, or display of tobacco products. So local governments really can't enact any of their own regulations on how tobacco is sold, marketed, displayed. That doesn't mean that nothing can be done. The first step, of course, is to talk about it and raise awareness of this issue, building grassroots awareness and support, and that is where we really need everyone's help. So you can raise awareness of point of sale marketing by sharing this information throughout your community, particularly within people of your sphere of influence, like coworkers, peers, family, friends, and others, and then think about who might be interested in this information. You know, I always encourage local tobacco control coalitions to engage non-traditional partners who might be brought into the fold of your coalition who otherwise might not be interested in tobacco issues. Neighborhood associations, PTOs, you know, people who are maybe working on other public health strategies such as reforming point of sale from a nutrition standpoint, healthy food access, eliminating food deserts, maybe working on alcohol prevention measures and alcohol sales at the point of sale. So just some ideas on how to engage maybe some non-traditional partners around this issue too, so that you can form an alliance. And, you know, one of the main takeaways, I think, is just to get involved. And one way to do that in Porter County is to join the Tobacco Education and Prevention Coalition of Porter County, as Dawn discussed earlier. So you can always partner with others in your community to help build healthier environments for where we live, work, and play. And this is a very localized issue, and we really need to work on it in Indiana. And so that's really all I had. I really breezed through those slides pretty quickly. My contact email is on this slide. If anyone's interested, just shoot me an email if you want to chat or have any questions about this information. And I'm happy to take any questions now or at the end of the event. I don't know, whatever Carrie and Mike you prefer.
Don, do we have questions for Caitlin?
Yes, we do have questions, and I would like to start off before I get to the questions. I just wanted to thank you, Caitlin, for the mention of non-traditional partners getting involved and joining the coalition, because there was a lot of data that you presented in your presentation. And just to brag a little bit on my students played a significant role in going out to the retailers in the community and using what's called counter tools to collect that data about our own communities. So that's something that might not occur to you. So don't feel as though, oh, well, I don't work for a health institution or anything like that. I don't have anything to offer to the coalition. if this is something that you feel passionate about, you are very much invited to attend a meeting and contact me or Carrie and talk through. And even if you just want to listen and ask questions, that's very valuable right there. So I do appreciate you mentioning that. And now to the questions. I have several for you. The first one is, I wonder why, if concern about vaping runs so high, we have not less than 5 vape-focused shops on Lincoln Way.
Yeah, so that's a really great comment and observation. I would point out how easy it is to get a tobacco license to sell tobacco products in the state of Indiana. It's incredibly cheap. Um, the only real requirement is to fill out a pretty simple application and have a permanent structure. So that's why we see a lot of tobacco retailers. If anyone's ever looked at the Alcohol and Tobacco Control Commission database of retailers, which is separate from our program, you have hairdressers listed, you have golf courses, resorts, hardware stores, antique stores. It's incredibly cheap and easy to get a tobacco retail license, which I believe is part of the problem why we see such an influx of tobacco retailers and vaping shops, especially as e-cigarettes have become increasingly popular with youth over the years. I would say that the solution to that is to talk to your, I'm speaking as Caitlin Rupp, the individual, not Caitlin Rupp, the state employee. Talk to your policymakers about passing more restrictions on density and proximity of tobacco retailers. And that would be one policy solution to just the inordinate number of tobacco retailers that we see in our communities.
Thank you. I've got another question here. Why should menthol flavoring be banned as well as all other flavors?
So that is a great question, and I could go on and on about this, but in a nutshell, menthol is a flavoring that has traditionally been marketed largely to the African American community, and it is also popular among youth as well. But dating back decades and decades, if you look at some of the older tobacco advertisements in magazines and billboards, menthol has been pushed to no end in the African American community, and in Indiana, nearly 90%, 9 in 10 African American smokers report smoking menthol cigarettes. African Americans also have higher mortality rates from smoking caused diseases such as lung cancer and heart disease. So menthol is kind of what I refer to as a gateway flavor to appeal to non-tobacco users and get them hooked and get them addicted. It's a little bit easier on the throat and easier on the esophagus as smoke is being inhaled from a burning cigarette as well. Kind of helps, the menthol additives in the cigarette help mask the harshness of the smoke, which is another reason why it's important to ban menthol flavoring in cigarettes, just as all other flavored cigarettes have been banned. So that's my response in a nutshell. I think there are some great resources on menthol that we can certainly send out and follow up.
Okay, we've got a few more really good questions. Do we have time to take some more questions?
We have, what, about 45 minutes? Is that right, Carrie?
Yes.
Okay.
All right.
I'm going to do one more question for Caitlin, and then we'll move on over to Megan.
Okay. How does someone report a retailer that is known to sell to minors?
Yep. So that's a retailer compliance issue, and you can contact the Alcohol and Tobacco Commission to report those violations. I'm happy to provide a link to their website if people are interested.
You know, if you have that link or can find it during the next speaker, if you could put it in the chat box and send it out to everybody, they'll be able to have access to that.
Yep, absolutely.
Thank you very much.
Thank
Great
you.
job.
Yeah, thanks so much, Caitlin Rupp. So Megan Fisher from Porter Stark Services is next. And Megan, let's talk a little bit about the effects of vaping on things like behavioral health in youth, teens, and young adults. I imagine that somehow those chemicals have to interact with their brains as they're growing up, and I don't think it's probably something that they really would want to have happen.
You're imagining correctly, Mike. So, you know, this is something that I think is often overlooked when we talk about vaping for our youth. If you were on earlier and listened to Lindsay's presentation, that the physical effects were just horrifying. So that in and of itself, you know, should be scary enough for anybody considering vaping. However, there are, as you mentioned, behavioral health effects as well. And there are both short-term effects and potential long-term effects. So when we talk about short-term effects, things that you can see in youth that have recently picked up vaping habits would be an impact on their concentration levels, lower attention capacity, having difficulty with learning in ways that they hadn't had difficulties before in school, decreased decision-making capacity, impulse concerns, you know, less capable of control over those impulses, and then mood swings, which can be, you know, either towards the depressive or towards the manic and you know, other side of the spectrum. And so all of those things can be seen in the short-term use. But then, you know, the real concern is we don't have a long enough history to understand yet the true potential for long-term effects, but we're starting to get some studies out there to see what those can be. There was a 2016 study that was published in the Journal of American Medical Association that talked about vaping and reported that vapors were more than twice as likely to be diagnosed with a depression disorder. When I make that statement, I do want to make sure that you understand that's not necessarily causality. There's a correlation, but we don't yet understand what the correlation is. There was another even more recent study in 2019 through the American Academy of Clinical Psychiatrists that reported that e-cigarette users were significantly more likely to have mental health histories, including attention deficit hyperactivity disorder, post-traumatic stress disorder, gambling disorder, anxiety, reporting low self-esteem, and endorsing traits of impulsivity. So we are starting to see you know, research coming out about this correlation, and you really can call it kind of a chicken or egg situation, which is true not just of vaping and tobacco product use, but is true across the board with any substance use and mental health disorder. And that is that early use of these substances, nicotine included, affects the brain development and can certainly trigger the development of other mental health disorders. Alternatively, folks who already are genetically predisposed for mental health disorders, including our youth, may be seeking substances or other problematic behaviors in order to address what they perceive as some of their mental health symptoms, such as anxiety. So it can go both ways. Now, why it's so dangerous for youth on the brain development side is because these kids are still malleable. The portions of the brain that are controlling decision-making and cognitive function are not fully developed until the early 20s. So kids in their, you know, adolescent years and even up into the college years, their brains are still trying to fully develop those portions that are controlling some of those behaviors that we just talked about. And as youth, those connections are being made very strongly And so as youth are vaping and using nicotine, they are not only affecting how the brain is developing, but they are actually reinforcing some addictive behaviors in their young lives that can become even more problematic as they grow older. So this isn't just mental health disorders like attention disorders or anxiety disorders or depression disorders, but this can turn into full-fledged substance use disorders related to other more, even more harmful substances as well. So nicotine itself is highly addictive. Our synapses are creating these strong connections, and adolescents can get more addicted more easily than adults. So this nicotine use can be a gateway substance to opioids, stimulants, other depressive substances such as alcohol. We are showing through a CDC study that teens who use Juuls regularly are up to 7 times more likely to try cigarettes or more dangerous drugs. So it really is a concern, not just in the here and now and not just in their physical health, but in an overall behavioral and brain development function kind of way. One other important thing I want to mention, which ties back to something Lindsay talked about, she talked about the fact that we still don't even know what's inside these vape liquids, right? There does exist a black market. Kids are tapped into it and are buying these pods or these products over the internet or directly off of the street. And so not only do health professionals not know all of the chemicals that are in it related to the nicotine delivery aspect of the device, but the black market, unfortunately, is now lacing vape products with other substances unknown to the youth that are buying these products. So worst case scenario, we have seen reports coming out of Lake County and some other surrounding counties of vape products, including fentanyl, which is a very dangerous opioid, synthetic opioid that can lead to overdose for a user who doesn't have any history of opioid use. So a youth who believes that they are experimenting with a vape product for the first time can use this product and ultimately could die from an opioid overdose without even understanding what happened to them, which is an extraordinarily dangerous idea. So a lot of dangers inherent in that, but I think, after having just said that, I want to sort of leave you with a little hope, which is that, when it comes to substance use, nicotine use, tobacco use, treatment works. And so we're here to talk about how we prevent youth from even tapping into these products in the first place. However, there's something to be said for if we identify youth who are experimenting with vaping, traditional tobacco cessation interventions are available and do work for vaping use as well. So whether it's a community health provider or a primary health provider, if we get this information, if we're screening youth for their use and we find out that they are using, we can get them tapped into services and hopefully arrest the progress of that addiction or that experimentation so that we don't see some of those long-term effects.
All right, do we have questions for Megan?
Yeah, we do, and you'll hear them better since I have unmuted myself. Let's see. Why do you think that they have to choose between vaping and smoking as opposed to choosing between tobacco use and no tobacco use?
What an excellent question. And it just, our youth are stubborn and they really want to, if there's something they shouldn't do, they really want to try it and experiment with it, unfortunately. And that's why I think a lot of what Caitlin talked about is so extraordinarily important, that as these products progress and advance and become even more tailored to the youth, the industry is just tapping into that innate desire for the youth to experiment with something new and interesting that they're curious about. And so, I think the other point to think about is, we've done some surveying, and I think this might be part of the next presentation on why youth do this. Why do they vape to begin with. And it's, sometimes they say it's because they are just curious. Sometimes they think it tastes good. That goes back to the flavor conversation. But related to what I'm talking about, sometimes they feel that it's relieving anxiety. The youth nowadays really are living under a lot more anxious times than some of us have experienced, especially in this COVID pandemic where things are so chaotic. And so there is truth to the fact that youth are dealing with some anxiety. But there is also a misconception that using the vape is actually alleviating anxiety. What can happen is, a kid starts vaping and does that regularly over a period of time, they actually become dependent on the nicotine that's in the product. Well, once you're dependent on a substance, if you stop using it, and especially with a substance like nicotine that has very quick peaks and valleys, they go into withdrawal. So between puffs of the vape, it's the anxiety that they're feeling that they want to relieve with the vape is actually withdrawal symptoms. And so they've caught themselves in a cycle that they don't know how to break. And they think that continuing to vape is helping them relax and be free and easy with their friends. And really all they're doing is feeding the addiction cycle that they've already started.
Okay, thank you. Do you find that there is a common age that you see when people are reaching out to try to quit? An age or stage when they have readiness to change?
What an excellent question. And I think if I had like the miracle answer to that, we could just erase the entire treatment industry altogether. But a magical age, I don't think so. There is such a thing called stages of change that we all go through when we're looking at a behavior that we want to modify. Everyone on this call has gone through it with respect to all sorts of decisions we make. Am I going to get a haircut? I don't know. I need to think about it for a while. I need to, and then if I contemplate it for a while, then I need to prepare to make the haircut. I need to call and make the appointment, and then I need to follow through and take action on it. And then if I want it to stay the same length, then I need to maintain my haircut. And so this is a silly example, but there truly are stages of change that we talk about in the field that apply to when somebody is ready to quit a substance or ready to address a behavior that has become problematic. And I think the key is, sadly, oftentimes people aren't ready until they've experienced so many consequences from that behavior that it's too painful to continue it, that they've tipped the balance in the direction of needing to seek help to address it because they can't stand the consequences anymore, whether that's financial, physical health, behavioral health, relationship difficulties. Maybe you've got a mom harping on you over and over and over again. Maybe your parents taking things away from you because they found out you're vaping, and finally, I need my car, I'm 16, whatever it is, that's usually the tipping point. And it's unfortunate that we have to wait that long for people to become ready to change. And that's why prevention is so important, having these conversations early on to prevent this from even starting.
Great. And I just wanted to make an announcement, and it's great that you just wrapped up with prevention, because the coalition does have a vaping prevention program that's designed for delivery in schools. And if anybody's interested in that, please reach out to Carrie Higgins, and she will be able to get you information and schedule something. Thank you very much. Well done.
Very good, Megan. Thank you. Now we move on to Dr. Teresa Kessler from Valparaiso University, the College of Nursing and Health Professions. And Doctor, you're going to talk a little bit about a vaping survey. We're kind of bouncing around a little bit, but I think a lot of this certainly is going to tie in. So tell us about the survey.
Absolutely. Thanks, Michael. Yes. As I mentioned at the start, that I work with a small group of undergraduate nursing students at Valpo. And a year ago, they brought up the idea for our research group to take a look at vaping. And one of the reasons they brought it up is that they had their own experiences in high school of seeing their peers and friends vaping, and they wanted to know more about it. And as being nursing students, they were learning about all of the negative reasons of why they shouldn't vape, and they really hadn't heard a whole lot about that in the past. We think that we may be doing a great job of getting that message out, but many students, through our survey, we discovered they haven't gotten that message. They don't hear that information. And so they, as students and our research team, wanted to find out what was happening. So we did a survey for across all 4 years of the students at Valpo last year. So this included the freshmen, sophomores, juniors, and seniors, and we did a randomized sample so that we get a good representation. And we were really happy because we got a 61% response rate. And so for those of you who do surveys, you know that's an outstanding response rate. So we feel really good about the number of responses we got. We think partly because it's the topic, they were wanting to hear about it and give their opinions about it. And in the end, we discovered that much of our data was very similar to what's happening across the nation for college students. And what we learned is that in the last 30 days, 18% of the students had said they had vaped. Now, when we asked them whether they had ever vaped or had been vaping beyond the 30 days, then the rate was 51%. And so we know that quite a few of them were engaged in the process. And so some of them just hadn't done it in the last month, but yet they're still vaping. That's still part of their behaviors. And the majority of them do it in social gatherings. It's definitely a social activity. And that social activity can be where they live. It can be out wandering around. It can be in the car. It can be anywhere. So it's a social gathering. So they do it alone as well. But most of the time it's done socially, done with friends, because it's something that they enjoy doing together. We also asked about when they started. So you were asking some questions about, what are the ages like and when can we get messages to them? Well, from our group, we discovered that over half of them started between the ages of 15 and 17. And for most of them, it was the age of 15. So they're freshmen in high school. And that was the largest group. Then the next group began vaping between the ages of 18 and 20. And that was about 45% of the sample. But the rest of them really started between 15 and 17 years of age. And a few of them had gotten messages and from the media, and that vaping was a good strategy to stop smoking. Now, they themselves weren't doing that, but some of them had parents or older relatives or adults that they knew were vaping because they were trying to do that to stop smoking. So that was the impression that they had, that, well, hey, if I'm a smoker, then vaping is a good strategy to do that. So they were supportive of those around them that were smokers and were trying to better their health by vaping. And so the impression is that vaping is safe. It's a good strategy. It works to stop smoking. So why is it going to bother me just to vape to have fun and be with my friends and do something social? Now, we also were interested in some other things that we were trying to make connections about why students vape, or what are some of the characteristics about college students that vape. And we took a look at their GPA and then the rate of vaping. And this was an interesting finding. Those with the lowest GPA, so less than 2.5, so that's in the lower C- range and going down, they had the highest rate of vaping compared to those that were in the A range of a GPA of like 3.5 to 4, and 4 being the highest GPA. And that rate was only 30%. And you could take a look at the groupings of GPA across all of those. So there was really a strong connection between vaping and GPA. And it's important to realize that's not cause and effect, but that there definitely were statistically significant differences in GPA and those that were vaping regularly. So that was an interesting outcome that we discovered. And we haven't seen that reported a lot in the literature. Then another one that we wanted to look at is just knowing Valpo and the student body. We have a fairly active Greek system at Valpo. And so those are individuals who are in sororities and fraternities, and they're social groups, and they have philanthropic projects and do a variety of things. But what we discovered is that there was a greater percentage of those in the Greek system that were vaping compared to those that were not in the Greek system. We don't have an explanation for that. We just know that there was a significant difference in vaping based on whether you were part of the Greek system or whether you were not part of the Greek system. And again, remember, the Greek system is very much a social network of individuals, and there's a lot of activities that we do together. And so that placed them different, significantly different than the rest of the students that weren't. We did take a look at the ideas that Megan mentioned about stages of change, because that is one of those foundations that are used to take a look at individuals. And we discovered of everybody who responded, about 20% had already quit vaping. So they had started in high school but now they've gotten to college and they stopped the vaping. And one of the things I'll talk about in a second is that one of the reasons is it wasn't cool anymore. It wasn't that different or that unique. And so they weren't vaping anymore. And then about a third of them don't see vaping as a problem. They have no desire to quit. There's nothing wrong with it. And so they're going to continue to vape. And then you have those that fall in the middle that are maybe thinking about it, but they haven't made a plan yet. But those are those individuals that we do have an inroad to make a difference and can maybe make an intervention to help them move along that stages of change. And something else to relate to what Megan said is that 3/4 of them said they were vaping to relax. And so they wanted that next hit to be able to go ahead and vape, and then they could feel better and relaxed again. And they knew that they needed to do that. Some of them that were vaping realized that that was part of the addiction. But in the beginning, it was something to relax and enjoy. And then now they're having to maintain that habit so that they can, manage those sensations that they're getting. Then one of the sad parts was in our surveys, Valpo has been a tobacco-free campus for a long time. And this coalition has made a huge difference and impact on having a tobacco-free Valpo process. And one of the things that was sad to hear is that 55% of them did not think it was necessary to have a tobacco-free campus. And that was kind of shocking for us to see that, Valpo's been tobacco-free for quite a few years. We even did research with this undergraduate group several years ago and did a survey and did education on campus to try and reduce smoking. But currently, last year, the group thought, over half of them thought that there's no reason for it to be tobacco-free because, again, they wanted to vape. Now, we learned some other interesting factors. We did some surveys, or not surveys, we did some focus groups in addition to the surveys. Because one of the things we learned that so many of them started vaping when they were young in high school and they were freshmen. And we thought, okay, let's target in particular the new freshmen to campus. And we did focus groups in which we had smaller groups of individuals who identified as vaping or having friends that vape or that they used to vape in the past. And we had a set of questions that we want to ask them to learn about, what is it about vaping? What are your perceptions? What are some of the things that we can learn about it? And some of the things that we learned were really kind of interesting in terms of their habits and the way that they were able to vape. So for instance, they talked about how they do it in high school, how they vape in high school. So they know that lots of times the boys and girls bathroom are monitored. Well, the handicap bathrooms aren't monitored. So they all go into the handicap bathroom and share their vaping devices in between classes and vape. They also spoke about how easy it is to vape in the classroom. So the teacher turns his or her back and they're not watching, and the students are vaping at the back of the classroom. And they can be very good about, pretending to cough or wipe their nose or do something, and that they're vaping in the classroom. But again, these were students on Valpo campus, so they come from not only Porter County, some of them could have, but they could come from various states across the US. And so we're all in agreement that, oh yeah, it's easy to vape in high school. There's very few messages about it being bad for your health. A few of them even talked about, they hear about smoking in their health classes, but at that time they weren't hearing about vaping. There could be consequences for being expelled or suspended from school for a short period of time. But there really wasn't much discussion about the health risks of vaping. And so that was sad to hear. The other thing they did is they talked about different ways that they can sneak vaping. So for instance, there was this long description of how they could take a vape product and put it at the bottom of a drink cup and attach a straw to that. And so when they're at work or they're with people that they don't want to know that they're vaping, they vape through the straw. And then others don't know that they're vaping. So they're doing it at work, like they work at McDonald's or Burger King or something, and they're vaping while they're at work because others aren't aware or can't see that they're doing that. So that was kind of a really interesting story that they were sharing with us. So, and they had other stories, but they're very clever. They're very good about ways to keep others from knowing that they're doing it. So in these focus groups, we came up with some themes to describe some of their ideas related to it. And they mostly agreed that they've learned that it's safer than smoking. So they might as well go ahead and vape because it's safer than smoking cigarettes, safer than using marijuana, safer than using alcohol. And so they're good with that. So vape is a great alternative because they haven't gotten the message again that it's not a good thing. The other theme that existed was that it's a cool thing to do in high school, because this is when they start vaping mostly, is when they're in high school. And they see others doing it, so they want to join in. It's trendy, and they don't think that there's a stigma to vaping. And it's what everybody's doing, and so we might as well join in with it. There was one quote that I thought was a good example, and I'll give you the quote. So first, it says, quote, "I still remember in high school when my high school boyfriend bought me my first vape, and I felt so cool. When I'd get pissed at my parents, I'd go in my room, hit the vape, because I was like, oh yeah, I'm the rebellious child, and I can do this." And that was not the only person making this, similar kinds of comments. So again, that they think that it's a cool thing to do. They get hyped up about it, and it's fun, and they're very much interested in doing it. Another thing was how easily accessible it is. We know that it's not that expensive. They certainly have, extra spending money that they can use to get it. And they also are able to get it from upperclassmen. That was the most common way. They're not old enough to buy it, but they just have to go to the upperclassmen or older brothers and sisters, and they can get it from them. So it's very easily accessible. And that was easy to access, and it was also easy to use in school. It was not found very often, and so it was easy to hide the practice, and it's easy to hide it at home. So that was one of the other things. Something else that came about is what we're calling the idea of generationally chill. And the way that we understood this through their responses to us is that they don't speak up to their friends because they don't want to judge them. They think that if you want to vape, fine, go ahead and vape. That's your choice. If you don't want to vape, then don't vape. That's your choice again. They don't feel it's their place to make a judgment about something that they're doing. And here's a quote that I thought you might like to hear. Quote, "Our generation, I think, is much more forgiving when it comes to things like marijuana use, vaping, drinking, things like that, because we are awesome." And I think it just depends on who you are as a person, and we don't care what you go ahead and do. So I thought that was a pretty telling statement that they had. They don't judge one another, and if it's something, again, that you want to do, then go ahead and do that. If I want to do it, fine. If I don't want to do it, fine as well. There were some, though, that had quit. As I mentioned, we had a 21% who had already quit vaping. And for them, they were starting to get the messages about how bad it was for them, or the side effects that they would have. Some of them talked about their friends having some of those side effects that Lindsay talked about, vomiting and the headaches that they were experiencing, and they knew that were related to vaping, and so they were stopping vaping because of that. And then also several of them, because of going into college and into the health professions, luckily, because we had some in that area of study, they were learning that it's not good for your health, and there's a little bit more information out there about it. But one of the contradictions to that is that as a group, they said they don't trust the media messages that are trying to tell us about what to do or what not to do. They very much don't have respect for those messages, and so it's not really impacting them. They need to kind of like learn the facts or experience the facts themselves for them to internalize that information and to make decisions about their own behavior. So even though they are starting to get messages about being bad for them, it's very difficult to stop again because it's behavior that they've started. And there's starting to be a few inroads in that process into getting them to quit. So those are some of the highlights of the information that we discovered for what they were experiencing, why they wanted to share with us about what was happening. And I think that we learned from them, and what our goal is to take this information now and then try and create some kind of educational initiatives on campus, sharing kinds of things to help them become educated about the true effects of vaping and things that we need to be concerned about. They talked about simple things like we didn't know that what the favorite flavor is mango, I guess. And so everybody, oh yeah, mango is one of the best flavors. So there's certain flavors that they agree on. And it was just interesting to listen to them talk about it and hear about their perspectives about things that where you could make an inroad. If the flavors are gone, that will be a huge impact on them not wanting to vape because it doesn't taste good anymore. And that's one of the reasons why that they're vaping. So I'll stop there and share the information and see if there's any questions.
Teresa, I'm kind of curious about, did any of the questions, the survey questions, talk about athletes at VU and vaping?
We did. We had athletes in the group, and actually that was one of the groups that we wanted to do a comparison. So I mentioned those involved in Greek system. We did take a look at those who were athletes versus non-athletes, and there was not a statistically significant difference. There are athletes that are definitely using vaping, and a few of them have stopped because they weren't performing to their best. And as an athlete, you know that's very important that you're performing at your top. And so that was one of the reasons why, as they went to college, the athletic participation became more challenging. And so some of them were stopping to vape or no longer vaping anymore because they couldn't perform. They couldn't get their best times. They couldn't do those things. Whereas in high school, that was more easily managed for them.
Don Spears, do you have any questions for Teresa?
Yes, I do. And I want to start off by telling you that you have a lot of fans in the group here.
Oh.
Your presentation has gone over very well,
Oh, thank you.
and you have a lot of kudos in the chat. But the first question is, did you get or did you find any correlations between students who vape and their performance academically?
In terms of like the GPA that I mentioned, yes.
That and whether they were more likely to drop out of college as well.
Well, since they were currently students, we didn't have that information, so I'm not able to answer that. And I'm trying to think. The American College Health Association is a group across the U.S. that does research every year with a very large sample. And I'm trying to think, I don't recall seeing information on that survey as well about dropping out. So that's a great question. I don't have an answer to that right now, but that would be a question. And I've not seen that reported.
Okay. The next question is, do you have a summary of these findings that is available to share? And are you planning on publishing these results? This is really compelling information about young adults and vaping, and thank you.
Well, thank you. Yes, absolutely. And that's one of the key outcomes of this undergraduate research group that I run. And I do that again in connection with a colleague of mine, Dr. Annette Raymond. The two of us really encourage the students to disseminate their work. And so first of all, they disseminate it on campus, because there's a time at the university where there are other students across campus in engineering and arts and sciences that are engaged in different projects, and they share that work. But I also hold a CREPT endowment, which gives me some financial assistance to support students to disseminate their work. And so they have disseminated their work at regional and even international conferences. And they'll be sharing this work in the spring at a regional nursing conference, and again next fall, our hope is to share it in an international conference. And so we do have a poster. The students have already created a poster that has the information from the survey. And in the start of the spring semester, we're going to be creating a new poster in which we're going to take all of this data from the focus groups and then add that to that work as well. So if you are interested, I was trying to think, I don't have a slide here with my email address on there, but I'd be happy to share that I can put that, when I'm done talking, I'll put that into the chat box if you're interested, because we could certainly share our poster that has this information on it and then let you know about what happens in our spring data as well.
Great, thank you. Another question is, why doesn't the state and politicians levy a substantial tax, more than there is now, on these products to make them almost unattainable if there is such a serious health issue?
Wow, I think that's a great question. And that's probably a question that maybe open up for the rest of the panel members as well. I wish I knew the answer to that. That would be a wonderful initiative to make a difference, because when things do get too expensive, I know these students talked about it's cheap, and was mentioned already by one of the other speakers that they can have it sent to their home. And some of the students just make their own. They get the products and they put it together, and who knows what they're putting together when they're making their own vaping products. But yeah, I don't have a direct question to how to make that happen, but really speaking with our representatives is key. And we were supposed to have a representative on our session this evening. I'm not sure if that person is attending.
I'm not sure. And I will say that a couple of years ago, the coalition did go down to Indianapolis with the American Lung, American Cancer, and the other major relevant health organizations, and we're advocating for a significant increase in the tax on tobacco, which I know is not vaping here, but it failed miserably. It did not pass. So there's not a lot of political will to do this. It's not popular, and people who use these products tend, even though it's the minority, they tend to be very vocal. And people listen when people use a lot of volume, and they have successfully resisted these taxes in the past.
Yeah, I would agree. I would think there's a strong lobby by these producers of these products, and so that they, the money speaks many times.
Absolutely. Okay. Thank you very much.
Sure.
Something we want to mention for free help on the Great American Smokeout, to quit your habit, it's 1-800-QUIT-NOW. Very easy number to remember. If you don't call today, call tomorrow, and see if you can give up either your tobacco habit or your vaping habit. I think that's a great idea to start going into the holiday season, into the new year, right?
Absolutely.
So let's see, we've got to talk a little bit about our goals for the program. We're certainly to find out as much information as possible about vaping and point of sale advertising. We wanted to find out about different things like behavioral issues associated with the vaping in teens. Now, the one thing I do want to ask is, do we have, with the coalition, Carolyn, you might want to answer this. I don't know, either you or Don maybe. Do you go into schools to actually teach kids about vaping and give them solid information about why they shouldn't start to vape, why they should just maybe think about not doing any kind of smoking at all?
Yes, I can answer that. I'm a trainer for the Catch My Breath program, and we can offer that in the school systems. Usually it's grades 5 through 12. I can then train the teachers to do that program. Dunlin already has somebody for sure. And I'm trying to find out from the schools right now who is trained and who is not, but we can take that in. And it's not just throwing information at them. It is also giving them the skills. They work with their peers to build skills on how to say no, basically, and how to look for alternative things. So it's not just lessons. It's also they get to practice honing some of their skills to kind of stand up for themselves and their friends who don't want to vape. But we have one other person who I wanted to give them a few moments. We have Attorney Scott Yanover, who did pop onto the call. And I know he wanted to just mention a couple things from the legal side of things.
Yes, thank you very much, Carrie. I just want to let you know, or engage you as parents, to let you know that the government had a good education policy, and they were able to reduce smoking amongst teens from 38% to roughly 3.8%. And unfortunately, when the invention of Juul has undone everything these education and public policies push has done. And what took 30 years to do, Juul has gotten rid of, and e-cigarettes have gotten rid of that in 3 years. These I'm suing Juul on behalf of 4 individuals who were in their 20s, who had severe medical reactions or physical reactions to vaping. One was in a coma, the others were in ECMO machines and had tubes tied up and ventilators for weeks on end. But the e-cigarette companies do target these youth through models and Snapchat and cute pictures. They put the nicotine salts in the Juuls, as Dr. Kessler or Megan talked about. the school systems are going to have dealing with addiction problems with these students in the not too distant future. So as we're suing on an individual basis, there's something going on in California right now that's called a mass tort action. And that's taking thousands of cases at the district court in San Francisco. But I want to make you aware of something else. There's also at the same time, 100 school districts from across the country are suing Juul on their own because they recognize that they're going to have future costs. I think Dr. Kessler was talking about what they have to do in schools with either vape monitors, taking down the doors of bathrooms. That's costs that they're incurring today, but they're going to be incurring costs of nicotine withdrawal. They need to have education programs in the not too distant future. So these school boards are suing Juul on their own. The president of the school board in Carmel said to me, Scott, even if we recover $1, at least we're saying to the parents, we're taking a stand into the public that this vape is unacceptable. And I urge you to talk to your school board presidents and members for them to consider taking an action against Juul because it probably will not go to court. They will probably settle. And you're going to need this money to educate your youth because with the budget cuts now that the state of Indiana is going to press upon the education system in the next year or two because of the pandemic, school systems aren't going to have the money to train and show the students what Dr. Kessler was talking about, these programs. So someone's going to need to pay for it. And by suing now, you may have some money to take some real concrete action in a couple of years. But I urge you to raise this issue with your school boards.
All right, thank you so much, Scott. We appreciate the info. Is there a number or a place where people could get a hold of you if they want to?
Sure, Carrie's got my info, but my phone number is 312-560-5120. And my email is syonover, YONOVER, @gmail.com.
All right, great.
I should have mentioned, I'm originally from Gary and Munster. I'm not just
cool.
Chicagoan here. So I used to work for Mayor Goldsmith in Indianapolis. And so I still have a love. My mom was an educator. So it breaks my heart to see these young kids vaping. And it's not just high school because they got older brothers and sisters. This trend is trending down now into middle school. And even there's some cases of elementary school kids vaping.
Hmm.
Yeah, I just heard today of a third grader that got busted with a vape pen in third grade. So I don't know if Shannon is still on. Shannon Morris is from our local resource officer. Shannon, are you still here?
I am.
Okay. I just wondered if you could briefly tell people what they're seeing, what you're seeing on the school side of things.
Well, hello everyone. Shannon Morris. I'm with the Valparaiso Police Department. I've been a school resource officer now for about 2 years, and what I've seen in just that short span of time, I'll tell you statistically, I have issued personally about 20 vape citations in the schools, and those do range from third grade all the way up to high school age. So it's here, it's happening at all levels. And we're seeing it just like every other area in the country.
Thanks, Shannon.
Thank you so much. Now, Don, do we have any other questions to get to for any of the panel members?
No, we are all set with questions, and we've actually come to the end of our time. So one thing that I did want to do is give Jessica Creech, our youth coordinator, an opportunity to talk about our Voice program. Is Jessica?
Hi, everyone. Thank you so much, Don. So I am Jessica Creech. I am the youth coordinator for Porter County Voice, as well as the coalition. So what we do with Voice is educate students between the ages of 13 to 18 to really advocate with each other about tobacco prevention and education. So I am actually certified to be able to teach peer-to-peer, like lectures and events for students to talk to their peers, to help prevent tobacco and educate them about vaping and the harmful side effects of all of that. So we are looking at building a core team right now. So a group of 5 to 10 students to really push these efforts and push this prevention. So I dropped a link in the chat to our website, and you can go on, and my contact information is on there, as well as a Google form for interested students.
Great, thank you so very much. And I would like to extend our sincere appreciation from the coalition to everyone who helped make this possible. Mike Bonaventura from Adams Radio Group, Megan Fisher from Porter Stark, Dr. Teresa Kessler from Valparaiso University, Caitlin Rupp from the Indiana Department of Health, Lindsay Sample from Northwest Health Pulmonary Critical Care, and also our own Carrie Higgins. Thank you for pulling this together and coordinating it. We appreciate it very much. Is there anyone that I forgot to thank, Carrie?
I just appreciate even all the panel members who showed up, but most of all the parents and the folks that came out to hear the conversation, because we had quite a few people from different areas, and that's where it needs to come from. But we need to really take a serious look at some of these issues and to make our voice be heard so that we can do things like ban all flavors so that these kids don't want to taste icky tobacco. That would help an awful lot. You know, talk to your legislators, write to them, let them know about this. I sure will be doing that. So, and please join the coalition if you want to help us out and actually participate in our efforts, because we'd love to have you. So we just thank everybody for helping. And if you need anything, you can go to our website, which is in the chat box, and I'll connect with you there and get you anything you need. I will be sending out a couple articles to everyone that just came through. The one that talks about what kind of action we do need to take, that will be sent out with the next email. And so then from then on, if you do want something else specific, I'll be glad to let you know that. I did get out the Porter County information to everybody, but a couple people said they didn't get it. So I'll just attach that as well to the email to everyone who appeared tonight. So thank you.
And to everyone who joined us, thank you so very much.
Thank you.
Wonderful evening, everyone.